Senator Tammy Baldwin. Senator, it's good to have you back on the program.
It's good to join you. Thanks for having me.
Looked at this Senate bill. What would it mean for the people of Wisconsin if it were to become law?
You know, health care is deeply personal. Let me speak for myself first. As a child, I had a serious illness and then was labeled as a child with a pre-existing condition. And I spent a lot of my youth without health insurance. I think that Wisconsinites, many families share that experience and share those anxieties of what will happen next. When I look at this Republican Senate proposal, I see a lot to be concerned about, but the bottom line is that most people will pay more for less care. We see very sizable and disturbing cuts to the Medicaid program, which covers most pregnancies and maternity cares, or almost half in the nation. We see cuts that would impact people who have loved ones in nursing care. And we see a weakening of the guaranteed protections that people enjoy today with their care, and perhaps even sort of tossing it to the states to decide whether those protections for people with pre-existing conditions would remain around.
Republicans, as you know, say, look, we've got to do something. Obamacare, the Affordable Care Act, is in trouble. They point to what happened in Wisconsin last week. 2 providers say we're opting out of the exchange. They talk about skyrocketing rates, premiums. They say we've got to do something. Do you agree? Do you think the Affordable Care Act is in trouble?
Well, let me take your question apart. First of all, Anthem Blue Cross Blue Shield did announce they were leaving because insurance markets needs stability. And right now, they don't have it. And they don't have it because the Republicans in the House and Senate are trying to repeal the health care marketplace, and they don't have that certainty that they need. They have disruption instead because President Trump and the Republicans in Congress are threatening to withhold support for the insurance marketplace, the type of support that helps keep out-of-pocket costs down for people in our communities. And so I do not buy the fact that that it is the underlying law that's causing the problem that led Anthem to leave. In fact, they wrote a letter saying just what I pointed to. The other issue is that, yes, costs are too high. And the bill that just got released from behind closed doors in the Senate will make it worse. It doesn't say anything about the high cost of prescription drugs. That's something that Washington should be working together to stand up to those drug corporations that are jacking their prices up for sometimes life-saving medications like the EpiPen for people with severe allergies. You know, I teamed up with Senator John McCain to introduce legislation that would rein in those prices and rein in those drug corporations. You know what those drug corporations got in this bill? A tax break. We need to be standing up, and there's all sorts of work we could do together to strengthen the healthcare system and reduce costs if we work together and parted with this partisan nonsense of repealing Obamacare.
You don't think Democrats deserve any of the blame for not wanting to work together? They basically have said, if you're going to repeal it, count us out. Could you have done more to work with Republicans on this?
Well, as I said, I just introduced a bill, John McCain is my partner, to deal with the cost issues related to the prescription drug issue, something that is very burdensome to folks that rely on prescriptions to extend their lives or treat illness. That said, yes, there's so much room for us to work together to bring down costs, but why did they release a bill that instead has an age tax and is going to increase the costs for people who have pre-existing conditions and weaken the protections that people now enjoy?
What do you do about this? I mean, they really do control the destiny, the Republicans control the destiny of this bill. What do Democrats do? Do you try and delay this so that the lawmakers, the Republicans, go back home over the holiday and perhaps hear from their constituents? What's the game plan here?
Well, Mike, I can tell you that the people of Wisconsin did not send me to the Senate to take people's health care away. And what I have been heartened by is how many Wisconsinites and people across America who have begun to speak out to tell their stories. I took to the floor on Monday night, nearly the middle of the night, to share the stories of Wisconsinites who had written me to tell me about caring for loved ones with multiple sclerosis, with diabetes, with, in one case, a young child with a congenital heart disease, all panicked, frankly, by what this measure would do and how it would impact themselves and their loved ones. So I think we work together to speak out, try to make sure that the public has the right to see this bill that was drafted in secret, and hope that we can persuade them to discard their partisan aims and work with us to fix our health care system for everyone.
I've only got just a few seconds left. At the end of the day, do you think Republicans will pass this bill?
Well, I would say that it's, for those of us who oppose it, it's an uphill battle. They do control the House, they control the Senate, and they control the presidency. That said, we have to fight, and we must win. It's people's health and lives that are at stake here.
Senator Tammy Baldwin is the U.S. Senator, the Democrat from Madison. It's good to have you on the program again. Thanks very much for being with us.
Thank you.